So, hello everyone, and this is Dr. Gobind Rai Garg, and with me are two beautiful faces. One, as I always keep on saying, is Ashutosh Rana. You can say our own Dr. Sparsh Gupta. And second with me is Dr. Fahina. She has got a beautiful rank of 1,210, 1,210. And what is most inspiring is this rank is from the last year of more than 1.7 lakh. So that is a massive, massive improvement. And we are really proud of you, Faina. First of
Thank you,
all,
sir.
congratulations.
Thank you, sir. Thank you, sir. Thanks a lot.
Welcome, Dr. Sparsh. Dr. Sparsh, please, I will ask you to please introduce Dr. Fahina and talk to her.
Of course, sir. It's such a pleasure. Hi, everyone. So this is me, Dr. Sparsh Gupta, your pathology educator at Cerebellum, and such a pleasure for me to have a conversation with Dr. Fahina. And as Gobind sir did make a mention on the fact, this would go out especially for all the people who have not got the desired result or the rank of their choice. And especially for the people who have a feeling that, their rank has been beyond 1 lakh. So, they have exhausted all scopes for any kind of an improvement, because here you have a wonderful lady who has proved with her own hard work, discipline, and grit that yes, you can do something better provided you have the right amount of guidance and the focus with you. So from 1.7 lakhs to 1,210. I mean, Dr. Faina, congratulations for this
Thank
massive,
you, sir.
massive improvement and jump in your, I would say, performance. And
Thank
now
you,
we
sir.
would like you to please kindly share the reason and the strategy that you used for this kind of a massive success.
Yes, sir. First of all, this wouldn't have been possible if my family had not been there to support me, and my friends who had all gotten the ranks before me, and they guided me properly that you should do your questions and your subject videos and all properly. So I would like to thank them also here. And regarding my strategy, I think first we should all finish off the main videos. You need not even need to study it. Just keep on watching the main videos, and right now just keep on, okay, this is what the subject entails. This is for people like me who didn't utilize their time properly during the 5 years of their college. So they need not feel like, okay, all my competitors and all my counterparts are really well versed, and right now they're just revising their topics during this 1 year of drop that they take. And that's how they all do it. They finish it off and then they take time and they just do their questions and sort it out during this 1 year. This is for people like me who actually did not study during the 5 years of their college. They will just do it for the final exam, the 1 month before where they give you a holiday.
University exams.
University exams. That's when I used to study. So for such people, we have to start the thing with the main videos, because our concepts would not be very clear at that time because we did not study properly. So after doing that, and then you take BTR or any source for that matter, I took BTR for studying it properly. You have to remember the things that you have to study, the various scores and the tables which they ask for the exam. And then you keep on adding the stuff which are not in there. Doesn't mean it cannot cover everything. Any source you take will not cover everything. So we have to keep on adding the stuff. The each new time that a question pops up that you see that is, okay, I don't know this concept at all, you have to add it, even if it is not a PYQ. That's what I think hit hard most of the people in these exams, because the exams was not entirely based on PYQs like the last years. So we have to make sure that even though it is not a PYQ, if it is a concept that you don't know, just add it with your notes. Take a source and add it with your notes. Keep a source that is a little bit smaller for you to revise. That's why I feel BTR is good, because you can have a little bit of source and then you can keep on adding new stuff to it. And just for me, it was like you have to start with the main notes, the very bigger stuff for you to study. Just keep on reading it, add on questions, and I think you'll be sorted out. And even if you take BTR, I think you'll be able to revise it at least 5 times. So you'll be sorted out. The 130 questions plus, you'll be sorted with the BTR. The next 20, 30 questions, you will get sorted out with your question bank. So I think that is enough. We need not go behind each and every source and that all that FOMO kind of stuff.
But I feel, Dr. Faina, what you already made a mention of is that the person has to watch the main videos and would follow a wonderful revision source like BTR. But my
Yes.
point is, since you made a mention of the fact that it has to be done 3, 4 times, how do you actually bring that kind of a discipline with you with all those distractions and the social media platforms, pulling you away from your academics? So is there
So
a specified number of hours one should be putting in, and how to utilize your phone in the best possible manner?
yes, sir. I mostly unfollowed all the kind of distractions that used to come in Instagram, and I used to follow only faculties there. So Gobind sir will be putting up questions on his story. I'll go and attend that. So even if I enter there, I will be seeing only stuff like this. If I want to relax a lot, I'll just go out, or I'll watch a movie if I want. Not the kind of series kind of stuff, so because that will take up a lot of time. You want to finish a series, or you. I don't have that kind of discipline to just stop and study. So I stopped all my hobbies mostly, and then I had a pretty good contact list of only 5 people who I used to interact on a daily basis, and then I used to study. That's all. And I think that everyone rushes and does a lot of hours during the last period of time, last 2 months, last 3 months. I think it will take a toll on your health and your body. So I feel that you should start studying, put a lot of effort in, maybe even 15 hours, 16 hours in the start of your preparation. If you start with 16 hours and then bring it down to 8 hours, it will be good to study. So that you feel like you are not putting in a lot of effort, because everyone will be cramming of stuff during the last minute. You cram up stuff before itself, and then you just keep on revising slowly. Even if you're not able to revise, just go and sleep, that kind of stuff.
Particularly for a lot of juniors who would like to follow you as a mentor, Dr. Fahina, what do you think is the ideal time when one should start, start preparation for the PG entrance exams? Should it be the first year or the second year or the pre-final year or the final year, as per your own wisdom?
Sir, I think the first year should not be focused on questions, because that you have to take your main book, the source, the very nice source that you have, nice book that you have, and read it from the book if you want. And then you will not understand a lot of stuff from it, but it will help you when you take your second year subjects and you read your Robbins book. That's what I did. I read my Robbins, and I think Pharmac, I took a very little book and I studied. I don't remember the book. It was not a very standard book, sir, but I read only the books. From third year, you can start your main preparation for thing, I feel, sir, for the NEET PG. Otherwise, you'll forget enjoying college also a little bit. If you
Agreed,
focus on the question pattern kind of feel, you'll forget to read a book. That's what I feel.
And sincerely speaking, do you feel all the 19 subjects should be given an equal importance, or some subjects should be understood, or you should be investing more time in them so as to have a better grasp, so that
Yes, sir.
it is going to be helping you out in cracking questions of the other clinical subjects as well?
Yes, sir, of course. You cannot straight away take medicine and study. You have to, or surgery and study. You have to go from the first year subjects in the order that it was intended. You have to start it from ANET and then from physio, focus on biochem. Then you can start your other subjects. I started personally with physio, sir, because I did not understand much of the stuff. So I started with physio. Then I went with path, and then I started the other subjects. I felt a little bit easier to understand.
Wonderful.
And to read.
Now, especially with a lot of times, it just so happens, Dr. Fahina, that let's say for things beyond our control, the exams, the dates sometimes get altered. Sometimes what happens is that people are facing some personal issues because of which they are not able to perform properly, and that takes a toll on their mental health.
Yes,
So,
sir.
any specific advice that you would like to share with us? I mean, particularly for the people who are going to be appearing in the subsequent exams, so that they are able
Yes,
to
of course,
maintain their mental health properly.
Because I have a personal example for this. During June or something, my dad had to undergo a CABG operation. So we were not here. I was in Meenakshi Medical College, actually, Meenakshi Hospital in Madurai.
Right.
So I was holed up there for at least 1 month, sir. It was keep on. And my studies, I did not study anything during the 1 month at all. The NEET was also approaching that time, and I was not even completing my main notes actually at that time. So I thought, okay, at that point, I felt that my family needs me. My mental health is important. So I just stopped studying entirely. I thought that this is not that much big of a matter. I felt the studies was, and then I kept it aside. And then I took care of my father, did all the time, all the thing. And then when he came back at home, I took a few days, and then I started studying again. It will take a toll on your health, but if you give a little, you cannot force yourself to study during those times. That's what I think. You will start hating studies if you force yourself to study when your mental health is not proper. You'll think that this is the reason why my mental health is not being proper, and so you take your time, a little bit of time, get yourself out of the box of this running race, and then I think we'll be able to do it again. That's what I feel, sir.
Dr. Fahina, I'm getting a lot of new perspective after talking to you. So
Thank you, sir.
one thing you have just told, which is very, very unique, and it's actually very good, that when you are not able to study due to any reason, then
Yes, sir.
stop even thinking about studies. Because if you keep on thinking and you are not able to study, you will get only stressed. So this is excellent thing you have said that, okay, I have to take care of my father. So that is my priority. So I will talk about studies later on.
Yes, sir.
That is an excellent thing to do. And
Yes,
you
sir.
are a proud daughter today.
Yes,
And
sir. Thank you.
number one. Then number two, I have come to know from you that if a student has not studied for 5 years, he not enough just for passing the exams, and he has enjoyed 5 years, and that is a good news for him that even he has a good chance.
Yes,
If
sir. Of
if
course.
a person has not studied for 5 years, but he has studied this 1 year thoroughly, then even he has a good chance. And the third thing which I came to know from you, which I will like to advise everyone, there is no shortcut to success. So if you want to get a good rank, you must first be thorough with your concepts. Suppose you have not studied for 5, एक में चल जाएगा, तो ऐसा नहीं होता है. It's not. So
Nice.
you have to be thorough with concepts, and for that, main videos are required. And but definitely you can jump from 1.7 lakhs to the early 4-digit ranks. So like 1210, and this you have told that I have wasted some time. Otherwise, it must be within the 3 digits rank. So definitely it would have been possible. So guys, I am finding these new things which I am very excited to say again. So I would like to say again that number one, take care of your mental health. And in the long preparation time, some days will come when you will not be able to study, maybe due to family reasons, maybe due to any reason. At those times, do not keep on thinking about studies and keep on getting stressed. Number two, start from the basics and be confident that even if you have not studied for a long time, still you can make up. So anything more to add, Dr. Faina?
No, sir. Just the main videos and the VTR, and then you're sorted. That's all. Just keep on adding the notes, the questions which you don't know. That's all. Keep on doing questions a lot. That's all.
Yes.
And at this point of time, Dr. Fahina, I would like you to give a shout out to all your juniors in your particular medical college. In fact, to all the listeners, all the viewers out here. And
Yes.
then just give them couple of most important advice, or I would say the pearls that you'd like to share with them so that they also come out with flying colors in the subsequent exam.
Yes, sir. The thing with Tamil Nadu is we actually, the entire of my state, except a few private medical colleges or the top colleges, we don't study during the 5 years, sir. We all take,
Oh,
this is something you'll see in Tamil Nadu, sir. We don't do that. Even my seniors have not done it. It's like they read the notes, but they won't prepare it, prepare like the other North Indian colleges or even Kerala, I think, so I don't know how. But in my college, we didn't prepare at all. In the entirety of my batch, 10 students would have prepared, sir, for this exam. That's what happened in my college. So that's what I feel. So even if you don't study, that's what I think. You can get a good rank if you take a drop for 1 year, sit down and study in your home or somewhere else, and then you'll be sorted. Just take care of your mental health. Eat well. I ate a lot. I put on a lot of weight. It's not a problem. Everyone will come and tell that you have put on a lot of weight. You have put on a lot of weight. Doesn't matter. You can take care of your health anytime. Just think that, okay, fine, I have to eat, then I have to study, you have to sleep, enjoy everything else, just study. That's what I feel, sir.
but I would slightly differ, Dr. Fina. My personal experience is that even though you said that a lot of people are not preparing, I think Gobind sir would also agree to it. Sir, we used to get, I mean, and we still are getting a lot of individual mails from students, right? People be it in their second year who are, having that prof pack, or people who are reading, let's say, some pathophysiology concept or some pharmacology concept when they are reading medicine. They still give a lot of mails to us asking their queries and doubts. So for us, it never seemed that, specifically people are not preparing for the exams. I mean, there can be a situation where people are reading, people are preparing, but then they may not be that open to, kind of acknowledging it.
Maybe that would have happened, sir. It would have been a little bit on the silent side, they would have prepared. I don't know, but the majority of people, I don't think I came to know about marrow only during my 4th year, sir. That's what I'm telling. I didn't even know that marrow existed. And for that matter, many people in my college didn't know. Maybe now juniors would have started preparing for marrow. Up to my time, I'm first from the 2016 batch. During that time, most people did not study. That's what I felt.
We'll keep our fingers crossed. We would rather say that people would also be coming through this particular interview and knowing more about cerebellum as well.
Yes, sir, of course, of course. I didn't know about that also, sir. That's what I'm telling. We didn't have that much of exposure to it. That's what I feel.
Agreed.
We have to keep on studying, and you have to prepare your concepts from second year. That's what.
Agreed. So I
Yeah.
think you have done a very, very fantastic thing, Dr. Fahina, by getting that wonderful rank. And much more importantly, as sir did make a mention of the fact, striking the right work-life balance, putting your mental health on priority, as well as showing everybody that yes, you have it in you and you can definitely achieve it with the right guidance, with the right amount of hard work, and
Yes, sir.
making your family proud. So many
Yes, sir.
congratulations to you and all your family members out there. Right? We
Thank you,
wish
sir.
that you achieve an equal amount of success in your professional branch that you're likely to pursue as well.
Yes, sir.
God bless
I
you, Dr.
think,
Fahina. Thank you so much.
yes, sir. Thank you, sir. Thank you, sir.
Dr. Fahina, I will like
Yes, sir.
to say again that you have done a wonderful job, and you will be a source of inspiration for many, many people who are disappointed right now. Clear?
Yes, sir.
So, on a daily basis, till the time the result has been declared, I am spending daily around 10 hours talking to the students who have not qualified and who have not got a good rank. So, and many of them are totally disappointed. They're like, I've got a I will do, I can do nothing in my life. So I kept on telling that this is not the end, because if you study properly, you will definitely improve. But talking to people like you, they also lift my morale that I can easily guide other students that yes, it is definitely possible. I am not just saying it is
Thank you,
possible.
sir.
There are a lot of examples sitting, and this is phenomenal. 1.7 lakh to 1200. That is phenomenal. And
Yes, sir.
lot of people, we will pause this, and lot of people, they will be motivated by this. And
Yes.
my one request will be, many of the students will want to take guidance from you also. Please reply them in the videos, under the comments.
Yes, sir. Of course, sir. Yes, sir.
And
Thank you, sir.
lastly, congratulations to you and your
Thank you,
family,
sir.
and
Thank you, sir.
best wishes for the future.
Thank you, sir. Thanks a lot, sir.
Thank you so much.
Thank
Thank
you,
you,
Dr.
sir. Nice
Fahina.
talking to you, sir. Thank you,
Bye-bye.
sir.
Take care.
Thank you, sir.